Well, welcome. My name is Brianna, and welcome to our very first webinar Q&A session. To tell you a bit about Future OB-GYNs, we are a student-led organization with members from various states in the US and other countries around the world. We are dedicated to advocating for global women's health and hope to spread awareness about conditions and inequities that society seems to often shy away from. Joining us today is Dr. Rachel Bervell from the Black OB-GYN Project over on Instagram. During the second half of the session, Dr. Rachel will be answering your questions, so make sure to stick around until the end. Today, I'll be getting some help from a few people to make sure that everything runs smoothly, namely Francine, Jordan, and Cadence. They are all part of our executive team, so we are actually taking applications for, so definitely check that out if you're interested in gaining some leadership experience. Also, if you aren't a member yet, definitely apply because we are having some fun things coming soon. Next week, we will be having our second session with a fourth-year medical student who will be explaining the match process and talking about her journey. But until then, I would like to thank Dr. Rachel for joining us and have her begin her presentation. So thank you all again for coming, and I hope you enjoy.
Hi, everybody. I am so glad to be here. This is so awesome, this Future OB-GYNs group. I think it's such a wonderful introduction to the field of medicine and healthcare, and kind of gives you a way of thinking about your potential future. So for today, because this is the first session for Future OB-GYNs, I kind of wanted to do a really general, like first things first type of talk. Number one, what does it even take to get into medical school? And then very briefly, what is an OB-GYN? So I'm going to share my screen. Oops. I think I might need to be made the host, however.
I will do that right now.
Or made a co-host to do that.
There you go.
Okay, let's try it again. Perfect. Okay. Okay, so I'm going to present this. And I love when people ask questions in the chat. So please, please, please don't shy away from asking questions in the chat. And hopefully we can get some of our, conversation started there, and then we'll go on to it a little bit later. But like I said, first things first, becoming a physician. Let's set you up for success from future OB-GYNs to OB-GYNs, right? Today, we're going to go through a couple things. We're going to talk a little bit about my path. Sorry, this is a horribly awkward picture. We're going to talk why medicine and the various professions that are within it. We're going to talk about the journey to becoming a doctor, an OB-GYN, a women's health provider, and really what is an OB-GYN, and hopefully get some time to talk at the end about a little bit more about the journey. So briefly about my path. I was actually born in Canada. My parents are immigrants from Ghana, West Africa. And I always begin my talk talking about my parents and my family because, one, I'm very close to my family, I think maybe more so than other people, but them being immigrants and having that perspective outside of the country, outside of the US, has really shaped my love and my passion in healthcare. In fact, it was an introduction through my mom, who was at the time when she first moved to the States, was actually working in custodial staffing, and she actually used to clean a clinic. And she was like, oh my gosh, the doctors, they are doing such incredible things. And then you kind of fast forward a little bit. My grandmother helped raise me for a lot of my childhood when my mom decided to go back to school. And unfortunately, she passed away when she went back to Ghana, but it was due to poor healthcare delivery. So I remember thinking when I was young, whoa, what's going on? I'm going to be a doctor because I want to change that type of outcome from ever occurring to anybody else again. It's really devastating when you have a loved one die, especially in a hospital or a clinic, and it kind of hits a little differently. So that was my impetus. But even before that and after that, I grew up in the greater Seattle area. I don't know, is anyone here from the Pacific Northwest, from Seattle? I'm not really sure if anyone usually is. Usually most people are on the East Coast. but I grew up outside Seattle. I'm the oldest of three, I have two younger brothers. And I was really involved both in my school. I loved learning. These are just some snapshots of a lot of my close friends from as young as third grade. I think that picture is from the top. And I see Emily and Anna. This is Emily. Let's see if she's not another one, but this is Anna, and she's in this picture here, and she's in this picture down here where she's right there. So, you know, just having really great friends and really great support systems, learning to enjoy growing up. Obviously, all of you are in that phase of life where you're in high school, loving your friends and realizing that oftentimes what you see as a young person are the memories that you will cultivate and keep with you close as an adult. So fast forward my path continuing. After high school, I went to college. I went to Harvard University in Cambridge for undergrad. And when I was there, I majored in neuroscience and did a minor in global health and health policy. We actually don't call them majors and minors. We call them concentrations and secondaries. This picture on the far left where we are holding a sign saying Hollis was in front of my freshman entryway. And it's so funny to look back on this picture. It's over 10 years old. Oh my gosh, is it 10 years old? 2009? Oh yeah, that's really scary. It's over 10 years old. But you know, so many people that I'm very close to, and my best friend on the top there, actually just texting her, Marjorie, and just other snapshots from college. I really enjoy college. It was not easy. It was really hard, and we will definitely talk about that at the end of the presentation if you have more questions or want to know what I did beyond the learning in the books. But what I will say is I had an incredible support system, much like I had growing up, of close friends who are still my friends today, who I still text. And I was really involved on campus. And I think that that's really important, that no matter where you are, you stay plugged in and very involved with the things that are around you, things that interest you. I had some incredible opportunities. I did an internship in Tanzania where we got to work with the Ministry of Health there, as well as a private health facility organization to really do an amazing study of all their private health facilities in the country. And then I also helped found the Wellness Project on the campus. And this picture here is that board, and I'm very close with all of them. We all have different paths, but Preetha actually right now is applying for internal medicine. Pri over here, she works for Microsoft. You know, we all did different things, but we were passionate about wellness, and that's what brought us together. I served on the March of Dimes national board. For those who are not familiar, the March of Dimes is an organization that's dedicated to really preventing prematurity and preventing birth defects. It was founded by FDR in the 1930s, originally to combat polio, and now it's really expanded into looking at healthy birthing because they tackled polio. They actually founded and helped fund the vaccine for that. And so they moved on. And this is a photo during Black History Month when I was part of that board. And you might recognize this very tall lady here. She's very pregnant. That's Lisa Leslie, the basketball player. And I was a speaker at that event. And so, you know, I really loved college because I not only had the opportunity to jump into things that were on campus, but do things that were outside of campus. And that helped me engage. So then, of course, this is a picture from a football tailgate. We had fun. So my path was a little bit different compared to a lot of people post-college. I did take a brief detour, went to graduate school, and I originally thought that I might be interested in doing some teaching. But I decided that teaching was wonderful, but I wanted to jump right into medical school. So as soon as graduate school was over, I actually was able to go to medical school in Chicago, and I loved it. All of these photos are during my time in medical school. And it was such an incredible opportunity because I think we oftentimes, I'm sure you have imagined yourself in medical school, you think of the science and what you're going to learn when you're doing your clinical rotations and what you're going to see when you're on the wards. But medical school is really more than that. It's a community of individuals from all different backgrounds, really trying to understand how they can have a role in healthcare systems. And so at my medical school at the University of Illinois in Chicago, we had we had opportunities to have team-based learning. So this was my first year of medical school. I was group 8, the Great 8. And in our group of 6, we would have the chance to dissect different readings, to analyze research studies, and to answer questions about pathology, biostatistics, biology, biochemistry together. But at the same time, we had opportunities outside of the classroom setting. So this photo right here is from one of our free clinics that we had on campus, where not even just on campus, but in the city of Chicago, where we actually went down to the south side of Chicago and provided individuals in the community blood pressure readings. We worked alongside pharmacists to help people understand their medications. There was one day of the year, every year, where the dental school would also join us during these visits, and we would set up a full comprehensive healthcare health fair. And it was incredible because we not only were medical students learning, but we were alongside our other health professionals, learning with them and seeing how they educated their patients. I don't want to say that everything that we did extracurricularly in medical school was medically focused. I was also part of the OB-GYN interest group board. This is one of the events we put together. It was a sim lab, but I was also involved in a lot of things that were outside what you traditionally think of as medicine. For example, I was part of the Student National Medical Association, SNMA, and when Laquan McDonald was murdered by police officers back in 2016, our medical school and many of the SNMA representatives led the blackout day. And so this is our blackout day for our medical school, where we all wore black in protest because of the inequities that we were seeing in our community, much like what has happened most recently in 2020. I was also part of the patient-centered medicine program at my medical school, and I loved it. I loved it because I was able to connect with patients on an individual level. I was partnered my first year with 2 patients. One was pregnant, and this is probably why I fell in love with OB-GYN and women's healthcare. She was pregnant, and I got to go to every single one of her visits with her in her prenatal period and attend her delivery. It was my first delivery I'd ever seen. It was just incredible and beautiful. And then I also was paired with another woman who had chronic illness. She had hypertension, and she was dealing with a lot of other social issues. And this is probably what also helped me get really involved with understanding social determinants of health, which we can talk about a little bit more if you have questions. During your 2nd to 4th year, it's a little bit different, the curriculum in that program, where you get partnered with a community organization. And the community organization I worked with my 2nd year, as this picture shows, is actually the day after Donald Trump was elected. I remember that. But we worked with domestic violence patients and domestic violence families, survivors of IPV. And during this day where this picture was taken, Maria, Dana, and I went to a fair for children, and we held a booth against bullying. And so in front of us, we have like a whiteboard. It's very small, but in front of us, we have a whiteboard, and we had people write down ways that they could stop bullying or ways that they could encourage others instead of being a bully. And, you know, even though in medical school, this is my medical class, we had a very large class, and that's me circled right there. Even though my medical school was, you know, very large, and I had a great community and great friends, as pictured here during one of our fun trips. And this is Dr. Morgan, who's one of my best friends from medical school, and also one of the founders of the Black OB-GYN project, my Instagram. I also stayed very close with my college friends, and these are some of my closest college girlfriends. You might recognize some of the same faces in the slide previously. This is my best friend, remember, that I showed you a picture of her. This was my roommate all 4 years of college. And I think part of getting older is recognizing, again, that you have this incredible past and this incredible opportunity to build memories, but you can take those memories and those people with you because they help you survive when you get to those really tough chapters. And medical school definitely is a difficult chapter. It's not easy by any means. So I think all of you here, and correct me if I'm wrong, I'm going to take a sneak peek at the chat if I can without messing up my presentation. But I think all of you here are interested for the most part in medicine. And let me know if that's incorrect or that people are like, no, actually I'm more interested in something else. But there's so many reasons to go into medicine. And these are just a couple that I thought off the top of my head. If you have some more, I would love to see it in the chat and kind of hear what your interest or impetus is for going into medicine. For me, as I mentioned earlier, I had that family connection where my mom said, hey, this might be something that you're interested in, or they seem to enjoy their job. And it really spun off of that personal experience, working with medical professionals, having shadowing opportunities when I was younger, but also thinking about what I wanted to do in the long run with my career and with myself. There are so many incredible fields outside of medicine, and so many of these fields make an impact on people. But for me, I really wanted to make an impact on people's health specifically. I love medicine because it provides you an opportunity for lifelong learning. You definitely have to work within a team, even if you do something like radiology or pathology that can seem really individual, you have to have other people around you. There's an opportunity to play detective, and everyone here has probably seen an episode of Grey's Anatomy or ER or The Good Doctor or Chicago Med or one of these TV shows. And obviously those are very dramatic. It's, medicine is not like House, but there is that ability to ask questions and try to figure out what is going on with my patient. How am I going to solve this puzzle of this unknown disease that they might have that needs treatment? And how are we going to treat them in the right way to make sure they're healthy and well? And then I think just at the baseline, most people in medicine love some aspect of medical science. And I think that medical science is a little bit more than just medicine and biology and chemistry. I like to remind people that medicine is both an art and a science. So those who love medical science love the humanities of it too, the history behind it, if they're given an opportunity to learn more about that, while they're learning about the pathology and while they're looking at cells under a microscope and trying to figure out if it's a cancer. So there's this ability to ask questions, play detective, but also want to know more in that field of science altogether. And of course, there's others. So I would love to see the chat at the end of this presentation to see what people have come up with for why they have wanted to go into medicine. But I do want to take a brief detour and talk about the many medical professions, because I think that, I want all of you to be doctors, of course, because I'm biased, but I also want to remind you, not only are you working on a team with all these individuals we're about to talk about in the next 5 minutes, but these are also opportunities if you decide that being a medical doctor might not be for you. These are other opportunities that you can really be in touch with a patient, and we need these professionals. They all require different levels of training. So I mentioned that for me, my journey started with, growing up, going to high school, graduating high school, going to college, then going to residency or grad school, and then being able to progress in my career. But all of these fields, let's say for you or for someone in your family who never went to college, they really want to be in the health field, there are still avenues to do that. And so I do want to kind of give a little bit of respect to that. First, we have someone called a CNA, or a certified nursing assistant. And this is usually a really short training program, and they just need to pass a certification test. And it's important to know about this because let's say you are the doctor on the floor and you're about to discharge your patient on the internal medicine wards, and you're trying to figure out where they can go. Sometimes we talk about sending patients to a short-term living facility or a short-term rehab facility. And oftentimes the people that are there at the facility making sure that these patients are continuing to take care of their surgical wounds, continuing to go to the bathroom appropriately, take their medications appropriately. Oftentimes, these are the CNAs. They're responsible for feeding, bathing, dressing the patient, taking vital signs, answering their calls for help, monitoring any changes in the patient's behavior. Sometimes they're the first person to realize or recognize something's awry or going wrong with a patient, especially those that might be even within a retirement home or a living facility for our elderly patients. They really do that minute-to-minute patient care. And so they're a really big part of the care team. And then we also have our medical assistants. Usually this training is a little bit longer. It can be up to 2 years in an associate's degree, so you don't have to necessarily go to college, and you have to pass a certification exam in order to become a certified MA. And their responsibilities are mostly within the clinical setting. So sometimes when you go to the doctor and you have someone checking you in, the receptionist, sometimes those people are actually MAs. They handle your medical records. And I remember when I was volunteering back in the day, when I was younger, medical records were all paper charts. So they would be the ones to make sure they can go back to the back end, pull out your paper chart when you came to the clinic. These days, most of the things that an MA does is electronic. And so they make sure things are up to date electronically, updating all the insurance forms and the correspondence on the back end, managing patient scheduling and whatnot. And they also can have other more clinical duties, like doing lab tests, collecting specimens. So when you provide a urine sample to check for a UTI, or even grooming you and before you see your physician and taking your vitals, sometimes those are also MAs. And then we have people in the field. When you call 911, who's going to get to you first, right? We have firefighters and police officers, but we also have the medical professionals that are first line before you see a doctor, before you arrive to the emergency room, to make sure that you are stable. So we're going to talk about the EMTs, and the next slide, the paramedics. Their training for EMTs is a little bit shorter than a training for paramedics, and they have, various levels. I know when I was a medical student, a lot of my classmates had actually previously been EMTs before entering medical school because it's a shorter training period. I know some people like to do that if they have time during college as an extracurricular activity. Their responsibilities are to provide urgent medical care to people in the field, working with our other civic leaders and civic professionals like police officers and firefighters at the scene, making sure that people are transported appropriately to medical facilities. You learn how to do CPR, you learn how to give oxygen. I mean, it's pretty cool. And I know that EMTs oftentimes, because they see pretty much everything in the field, they actually have to do some of their training on the labor and delivery floor. So they have to see a couple deliveries in case they have to manage one out in the field. And then we have paramedics. Like I said, they're a little bit more training and a little bit more advanced, more responsibility, and as such, got paid more than an EMT. They do usually require some sort of prerequisites at the college level, be it biology, math, or English, and they do have to pass a state licensing exam. The reason is because they are doing way more. They're not just doing CPR. If they find the patient unresponsive, they're the ones that's gonna put the ET tube in, the endotracheal tube. They're the ones that are ready to defib somebody, and they can read an EKG monitor. They know how to do advanced airway management. So they're that step up of not just getting you to stable, but making sure you're alive between that time that you make it to the door of a hospital. So we are very, very grateful for the paramedics that are out in the field, and their job can be pretty intense. I'm sure all of us are familiar in some way, shape, or form with an RN, a registered nurse. Nurses are, in my opinion, the backbone of a hospital. There's many ways that you can get there. The most common way is either doing a BSN or a bachelor's, so majoring in nursing as a college student, or entering a graduate school program for nursing, and you must pass the nursing licensure exam. The responsibilities of a nurse really are so vast, but I think of a nurse as the day-to-day person getting to know the patient on the floor. They know how to assess your history and your symptoms. They know how to assist you during surgery. Oftentimes after we do a procedure, you will be seen by the nurse to make sure you get the appropriate medications, to make sure that you're well taken care of, and that you understand what is said on the discharge paperwork. So giving you an understanding and explanation of the home care procedure and home care care just in general. They oftentimes provide a lot of emotional support to the patients. I think of our NICU nurses, so our neonatology nurses, those in the baby ICU, where they are the ones that are holding families' hands who are crying or jubilating, right? You are the one that's right there. Yes, a doctor is there and there's other health professionals, but the nurse knows these patients so intimately. And then of course, they can help dispense medications as well. And very similar to a nurse, we have a nurse practitioner who's a little bit more advanced than just an RN. Usually this is someone who has some sort of master's degree for nursing, and oftentimes they do it together. So you might have someone who majored in nursing and they want to be a little bit more in the leadership of a hospital. So they become a nurse practitioner, so they can be advanced level as well as mid-level. And these individuals do very similar responsibilities to an RN. And both of these usually have some sort of supervision from a physician. And sometimes you can even see an NP as your primary care clinician, especially in an urgent care setting. So I know, for example, CVS has their Minute Clinic. I had to get a TB test done, and my TB test was done by an NP. And they would have been the ones to, not only talk to me about TB, talk to me about my exposures if I had any, but also read it a couple days later. And so we are really grateful for them, because especially in places where we are lacking in a lot of medical care and support in rural areas especially, and we're looking for more primary care providers, so pediatrics, family medicine, and OB-GYN, a nurse practitioner can be a great fill-in. And then next up, we have the physician assistant. And this is like as close as you can get to being a doctor without quite being a doctor. These are people who have also gone to college, they've done a PA program, they've passed their licensure exam, and they have a lot of flexibility to help physicians. I know when I first encountered working with a PA, I was a third-year medical student on my surgery rotation, and all of the assistants, if I wasn't there as a medical student, or there wasn't a resident, so doctors in training, the PA was the one that was helping with the procedure. They knew everything about the OR, everything from, what the surgeon was about to do next, what he needed to cut, when to suction. I mean, they were right there as if they were the physician or the surgeon himself. And I thought that was so amazing, because it provides, again, that extra layer of support in clinics or hospitals where we need them. So they also can serve as a primary healthcare provider if necessary, much like our nurse practitioners. And last, but definitely not least, before we get to MD, I do want to give a huge shout out to our PharmDs. So these are physicians, or doctors, I should say, but doctors of pharmacy. They go to college, they go to pharmacy school, and if they so choose, they can also go to residency. They pass a licensing exam, and we work so closely with our pharmacists. Yes. Don't get me wrong, I took a pharmacology class in medical school, But when it comes to medicines and making sure I'm not going to mix the wrong things and do it on accident, my pharmacist is there to call me. The amount of times I'm like giving someone a med and the pharmacist is like, hey, Dr. Bervell, I don't know if you want to do that right now. The patient just got this other medication. We don't want to mix them right away, or make sure, you made a typo here. I think you might want to clarify that just in case the patient has a misunderstanding of how she should take these outpatient medications. That's coming from my pharmacist. And there's different levels of pharmacists. So you might be familiar with the ones at Rite Aid or the ones at Walgreens or at Safeway and Albertsons at the back of the store, where they kind of help dispense your medications and advise you. We call those community pharmacists. And they are great because a lot of what we will be interacting with, especially when we get our COVID-19 vaccines as a community, is with our community pharmacists when you go to the grocery store, unless you get your immunizations from your hospital setting. And that's where you might run into a hospital pharmacist. Oftentimes, a hospital pharmacist is the one looking over the entire facility's medication dispensing. So they know what's getting ordered. They know like what the patient is getting. And so they can kind of flag if things shouldn't be mixed. I call them often when I want to figure out, especially for more tricky cases, what the best regimen might be. Sometimes they participate directly in hospital rounds. So they go with us to the bedside of our patients to either talk to the patient about their medications or to advise us what the best medication course might be, whether that's with an IV drip or an oral medication. They help control the dosages of things. And if we need help doing weight-based calculations for our peds patients, which are really tricky, they're the ones that we call if we need that extra level of oversight, because they are the doctors in this field. So pharmacists are really awesome. And then, of course, the MD. And that's why I put a heart there, because that's what I am. So you do 4 years of college and you do 4 years of an MD program. There's also other ways that you can be a medical doctor, and that's called a DO, a doctor of osteopathic medicine. It's just a different way of learning and a different way of training. You have to pass multiple licensing exams, which I think is a little bit different than what we have seen previously with the other type of healthcare providers. You complete residency in your chosen specialty. So OB-GYN specifically is 4 years of residency, and you complete fellowship training if you decide to further specialize in that field or whatever field you want. Really, our responsibilities are quite broad and vast. We see patients, we take comprehensive histories and do physicals. We have to know how to develop a differential diagnoses. So differentials are when you see a patient, and let's say it's a young woman, she's age 19 and she has abdominal pain. Okay, that's who's coming into emergency room. What's going on with her, right? Where do I even start? What questions do I want to ask her? Do I ask her, where the pain is? Okay, that's a good start. But, she says my tummy. That's not going to get me to the diagnosis quite yet. I can ask her if she ate something recently, how long the pain was going, if the pain comes and goes, what type of pain it is. Is it sharp? Is it colicky? Is it twisting? Is it achy? Does she throw up with her pain? Is it just pain that's kind of there? Has she had this before? Is she taking medications to make it feel better? And then we can do some tests to test what the diagnosis might be once we start drilling in. Does she need a CT scan? Does she need an ultrasound? Is she having a ruptured ectopic or an ovarian torsion? Or is she having a bout of appendicitis and needs to be taken to the OR stat? And then you can develop care plans. So let's say in this case, she had something called the ovarian torsion, which can happen when the ovary in the body, and I didn't put too much like anatomy to this lecture, so maybe in the future we'll do some more like OB-GYN specific anatomy talks. But the ovary in your body, the body of a female patient, twists on the pedicle. And sometimes it can untwist, but sometimes when it twists too much, you can imagine if I were to twist something, all the blood within that area kind of gets stuck and relegated to one space, and it cause a lot of pain and later necrosis. And our ovaries are really important for our hormonal care and balance, especially given the fact that it's a big site of estrogen and a lot of other things. And so it's a medical emergency. So we take her to the OR, we do surgery, we either untorse it, or maybe it's already far gone, we have to remove the entire thing. What are her care plans afterwards? The physician is the one that they would call to be like, hey doc, you did her surgery. What do you recommend she does next? How does she take care of her wound? Of course, give those directions, and the nurse would know much more about how to talk to the patient, but give those directions to the nurse, who would then relay the message to the patient, or I directly would go to the patient and say, it was so great, Ms. Smith, meeting you. I'm sorry we met under these circumstances, but I'm glad you're feeling better. You will see me in 3 weeks and again in 6 weeks to make sure everything is okay with your incisions and everything's okay with the surgery and that you're stable. And then we correspond with other providers. So I call my pharmacist, I say, hey, what meds do I need to give her for pain? Should I give her a narcotic, or maybe I should hold off because I know she has a history of an addiction. So what are some other alternatives that might not be so addictive? My pharmacist gives me some advice. Hey, my nurse, I want to make sure that you can take care of her. She has to be in the hospital for a couple of days. What are some things that are coming up when you talk to her day to day? How is she feeling emotionally? Oh, we did talk about that addiction issue. Maybe I should get the social worker on board just to make sure that she has a good place to stay and she knows that she has support if she wants to quit. And then you can have a PA and NP also oversee that type of conversation on the back end, in addition to the MD. So MDs do a lot of different jobs, but again, it's all in this context of a team. And I only talked about a few medical professionals, but I do want to give a huge shout out to these and so many more. I didn't even name all of them. But we have dentists, obviously we all get to get our teeth cleaned to look nice. We have our physical therapists, like after surgery, let's say someone had an amputation because of diabetes, for example. How would that person learn to walk or use their new prosthesis? They've never been there. Or someone who can help them mentally, like a clinical psychologist, with this new change in their well-being and healthcare, or a clinical social worker, like I mentioned, who can kind of make sure that you're situated when you're discharged, a respiratory therapist who we owe the greatest thanks and gratitude to, especially in these times of COVID. They're the ones that are really making sure that people are okay, a phlebotomist who takes your blood, a lab tech, a chaplain who could be there to pray for you, or whatever religious support you need while you're in the hospital for you and your loved ones, and so many more. But I do want to focus, of course, on medicine and becoming a physician, because that's why I'm here. And I assume that's why you all are here too. I talked about my journey, but I do want to make this very broad and general for everybody. Okay. So all of you are in high school right now. Maybe a couple of people are in college. Or not, yeah, maybe a couple people are in college. I'm not really sure. Maybe people in middle school, but everyone should graduate high school and try to go to college, go to a 4-year college. Of course, you can become a physician if you go to community college, but it's best to transfer 2 years later after getting your associates to a 4-year college. And after college, you can do whatever you want. I have classmates or have had colleagues who went straight through. Age 22, they graduated from college and they went straight to medical school. And then I have so many friends who did a bunch of other things. I had a classmate in my class who was a lawyer for several years. She was in her late 30s and decided, I want to be a physician. You can go to graduate school like I did, where you can either get a master's of science in a field and do a post-bac to kind of boost up your grades from college, or if you decide later on in life that you need to get more medical oriented subject matter under your belt, you can do that as well. You can enter a whole career field like I mentioned. Let's say that you really want to be a doctor, but you kind of want to try the health field first and see if it's actually for you. You can be an RN, for example. or you can be a profession absolutely outside of medicine. You can go into research, which a lot of people do. Sometimes people want to take a gap year between college and medical school because they're not quite ready to enter more school right back to back, but they don't want to lose that interaction they have with the healthcare field. And so they're in a lab or they're doing some sort of community-based research. Sometimes people are scribes in the hospitals. So as a physician is taking a history from their patient, instead of the doctor writing all the information, the scribe is the one that's actually dictating everything for that clinician to have afterwards. No matter what you decide to do, there's so many paths, all of them can get you to medical school. And once you're in medical school and you complete those 4 years, you then go to residency, as I mentioned earlier, to do your specialty. So for me, I am an OB-GYN, kind of in transition as well. And you can go into OB-GYN and do your residency after 4 years and say, bam, I am done. I am attending. Or you can say, well, I really love global health and OB-GYN. I love the perspective that it gives me outside of this country and the ability to kind of merge emergency medicine with OB-GYN care. Kind of like the way I was talking about the paramedics out in the field, know how to handle a crazy emergency with low resources. And that's kind of what a global health fellowship would look like. Or I love maternal fetal medicine, which is a field that focuses on high risk pregnancies, but you need extra training in order to be that type of provider. So you would go to fellowship. There's fellowships across the board. There's fellowships in addiction medicine, there's fellowships in behavioral health, there's fellowships in reproductive health care, and they're not just in OB-GYN or family medicine, they're in every specialty. So a pediatrician can decide to subspecialize and go to fellowship in emergency medicine. So when you go to the hospital, instead of seeing just any emergency medicine physician or any pediatrician, they see someone who focused specifically on peds ED. You can have a surgeon who is not just a surgeon for the whole body, a general surgeon, but they decide that they really want to focus on thoracic surgery. So surgery of the chest cavity, and that's where they have their expertise. Or you can have an internal medicine doctor who does their 3 years of training, but they say, no, I love the heart. I need to know everything there is about the heart, everything about diagnosing problems with the heart. If you have a heart attack, what type of heart attack that is, if there's a blockage of the LAD, what does that cause, how will I help my patient make sure he or she is healthy. So you decide to do a fellowship in cardiology. No matter what it is, you do your training and residency and fellowship either or not either or, but either and, and then you become an attending after several years of school. So I want to give you guys some tips for success along the way. Okay, I think I've been talking for about almost an hour, so we're getting towards the end, and I'm really excited to kind of open this up to conversation. And that's me, obviously, and that's right in front of my hospital. I don't know, you can't really see me too well, but that was right when COVID was starting, and so a lot of hospitals were doing, remember when it was like 7 o'clock somewhere and you would do a round of applause, and my hospital did like heroes work here. It was really cute. And then the MD is for my graduation from med school. But let's get into some tips. So high school, where most of you are right now, do the best you can, study hard, and participate in extracurricular activities, and make sure that you're doing things you enjoy. I think, it's easy to be like, I really want to be a doctor. So everything I'm going to touch, everything I'm going to speak, everything I'll do is physician, doctor, medicine related. But don't forget that you're a person with so many other interests. You might like sports, so be a volleyball player. You might like art, so paint. You might love theater, so be a part of your school production or music. Volunteer and definitely have a heart for service, because I think no matter what you decide to do in the healthcare field, there's definitely an aspect of service, because you can see it's a lot of school, a lot of training. And so you really need to love or develop that love for helping others, and recognizing that you might not always get the accolades for it or the payment for it. We all think about that doctor money. You don't get that for quite a while until you're attending. And so really make sure that you've developed within yourself the want to help others, and have fun as you get exposure to the medical field. I do think if you have the opportunity, if you have the means, and you have the access, it's really important to start shadowing doctors, going to a hospital, volunteering in a clinic. And that can honestly be as easy as being a greeter in the hospital. It might be a little hard now because of COVID restrictions, but we need you. We need you to help show patients around. And you might have seen them, people who say, oh, you're looking for the oncology suite because you're here for chemo. It's around the corner to the right. We need those people. And those people oftentimes are high schoolers like yourself. And like I said earlier, plan on going to college so you can finish the requirements that are needed and necessary for the application process. When you're in college, do whatever you like. You don't have to major in biology, or you don't have to be pre-med. I think that was one of the biggest misconceptions when I went to college. I was like, oh my gosh, I have to be, I have to be a biology major. We didn't have pre-anything majors at Harvard. And so already I was like, okay, well, if we have no pre-whatever majors, I have to do human evolutionary biology because it's kind of human related and biology related, or I have to be a physics major or something. But that is far from the truth. The bottom line is do what you love, because what you love will make you happy in college. And college is like the first time you're away from home, but it'll also make sure that you have a broad understanding of something else. I think it's really easy to be focused on medicine. And I can say this looking back as an adult, get stuck with only medical talk. Trust me, it happens, and it will happen, especially when you go to medical school. Literally all your friends will be at the dinner party and all you're talking about is that crazy case you saw in the OR. And sometimes we're sitting there, we're like, don't we have lives outside of medicine? And we definitely do. But I think starting in college to cultivate those interests outside of health is really important because it makes you a more well-rounded person. That being said, there are prerequisites for medical school. And so no matter whether you're a history major or an English major, an economics major, you do need to make sure you get the basic courses done. And they for the most part have been the same throughout. So that's general chemistry, organic chemistry, biology, physics, math, some other courses like biostatistics. I believe they're requiring people to do a psychology class or some sort of humanities class that's within the health field, recognizing that medicine does not operate in a vacuum. And then again, just like I said for high school, participate in extracurricular activities and make sure you have exposure to not just medicine, but things outside of medicine that make you happy. So research, volunteer, really get into the community. I know for me, and these are some pictures from my college experience, I was part of the African dance team, which was really fun. I was part of my class committee and class council. I got to speak at graduation because I was elected by my colleagues to do so. I was, like I mentioned, part of the wellness committee. I really wanted to enjoy my college time and my college years. But also it's really important to make sure you have exposure to medicine if you want to be a doctor. As much as I'm saying, do whatever you want, be you, let's say you really love ballet and everything you do is about teaching and education. I love that. But if you apply to medical school and nowhere on your application do I ever see that you've had exposure to the health field, it'll make me scratch my head and be like, do you really know what it takes to be a physician? Or maybe you would be better suited to be an academic or an educator because that's what your application looks like. So it's so important to still expose yourself to the field. Especially in college, there's oftentimes opportunities to do more than you would have had a chance to do in high school. And I really recommend finding a mentor who will encourage you. I think a lot of people along the ways will get really down because they feel like it's really competitive, and it definitely is competitive to get into medicine. I'm not going to kick that under the rug. It's really competitive. But I think it's important to have a support around you, not just your friends and colleagues, but someone like myself, someone who's an adult, someone who's in the field, who understands the process and really understands how we can highlight the things about you that make you special and make you needed in the field of healthcare and as a physician. I do want to talk briefly about the medical school application process, even though you're very far off from it, just to kind of give you a sense of what the application process is, because this is usually that big hurdle that people are really stressed about. So you fill out something called the AMCAS, and that's like the common application, so to speak, for medical school, and it's a summary of your college or your pre-medical school experiences. Remember, I said not everyone goes to medical school right after college, so you got a chance to describe everything you have done in your life. You write a personal statement about why medicine and about your journey. You get letters of recommendation, so someone has to vouch for you and be like, this person's awesome. Not only did they get a great grade in my class, but they babysat my kid, and they really were attentive to his or her needs. And I can totally see them translating that type of energy and attitude in a medical space as a future pediatrician, which is exactly what she wants to do. You have to take the MCAT, which is like the SAT or the ACT in medical school, and it's a lot of people's bane of existence. Trust me, it's a tough test, but you have to take it. I'm sorry, I know. But it also kind of helps you study and prepare for your coursework, or actually it's a good way of reviewing your physics, your organic chemistry, your biology that you might have taken when you're a college student or in your post-bac program. And then there are interviews that you have to attend. I know this year those interviews were almost all, if not, I believe all of them were virtual. And these interviews just give us a chance to make sure that you're a real person, that you are dimensional. I think it's really easy to appear perfect on paper, but then we kind of meet someone and they're a little bit awkward. And there's nothing wrong with being awkward. I'm very awkward. But I mean, when I say awkward, what they have on paper does not match what we can see in real life or see in a clinical space. And also, every medical school is different. And so sometimes they're just looking for a medical student or a future medical student that could fit the culture of that program. And so that's what the medical school application process is all about. Now, let's say you made it. Woo! Round of applause. You made it to medical school. I'm so proud of you. You did all the hard work, and here you are. You kind of have most medical schools broken up into two components, the preclinical years and the clinical years. During the preclinical years, you're looking at body systems, and you're also trying to understand health from a very book way. So you're not really on the wards, you're not on the floor, you're not seeing patients right away. In some places, in some schools, you are seeing patients right away, but you don't have the autonomy that you would yet have as a third or fourth year medical student, or even beyond. You're really learning from the textbooks what anatomy is, where the heart is in relation to the liver, right? What is distal and what is proximal, what is medial and whatnot, what is caudal and what is, cranial and et cetera, dorsal, knowing what those terms mean. You do histology, which is looking at cells and trying to understand where that cell is coming from and what that cell represents. So is it diseased with cancer, or is it a healthy cell? You learn pathology, which is the disease state of the body, as well as immunology, cardiology, pulmonology, nephrology, reproductive health, and so many other body systems as they relate together and from a very textbook standpoint. And then you take step one, which is your first board exams, and you transition into years 3 and 4, which are clinical. So you're in the hospital doing what you've always dreamed of doing. You're on the wards talking to patients and rounding early in the morning at 5 or 6, checking in on people after their surgeries. You're in clinic asking them what's bringing them in today, or what immunizations they need, or if they've been taking their medications. And almost every medical school does these core rotations in psychiatry, surgery, pediatrics, internal medicine, family medicine, and OB-GYN. Those are the 6 core. Every medical school does it. And then you have some others that you might be able to do or are required of your medical school, like neurology and radiology, and electives and anything you want to explore. So I know for myself, I did dermatology when I was in medical school because I really wanted to explore that. I know some medical schools have breastfeeding electives, some have health policy electives, some have medical Spanish if you want to learn how to speak Spanish medically and be able to converse with someone in that type of setting. And so there's so much to offer in medical school. But I know all of you, and I'm so sorry I look so exhausted in this picture because it was after a 24-hour shift. But I know all of you want to be an OB-GYN or some sort of women's health provider. So what does it take after you're done with medical school? Well, first, you've taken step 1, your first board exam. You've taken step 2, your second board exam. You've applied very much like you applied for medical school, but this time with the ERAS application. And now you've been matched to a residency program where you continue your training. After 4 years of OB-GYN residency or 3 years plus 1 of family medicine residency, voila, you are a full-fledged women's health, reproductive health provider. OB-GYN is broken down into 2 subspecialties, okay? OB-GYN is OB-GYN or OB-GYN or OB-GYN. You hear different people saying it different ways. Obstetrics covers everything related to pregnancy, childbirth, and postpartum. It is literally a pregnant person, okay? That is what obstetrics is, and that's what it's relegated to. Gynecology, on the other hand, really tries to cover the health of the female reproductive system. So looking at the vagina, the uterus, the ovaries, cancers of it, just, pathologies of that specific area. So it has nothing to do with pregnancy. In fact, you have some people who after their residency, they do fellowship just to be really good at gynecology. And if they see a pregnant person, they're like, oh, Lord, help me. I don't know what I'm doing. Get her away from me. And vice versa. You have a pregnant patient, the obstetric person's like, give her to me. Oh, she has something else like abnormal uterine bleeding. Send her the other way. And so it's 2 subspecialties put in one that you are trained with. But there's even more subspecialties within the specialty. So I alluded to this earlier. There's MFM, which I already talked about. There's REI, reproductive endocrinology and infertility, which focuses on really looking at the fertile state of an individual. So doing IVF or in vitro fertilization. There's gynecological oncology, which focuses on treatment of cancers of the reproductive organs. There's FPMRS, or female pelvic medicine and reproductive surgery, most commonly known as urogynecology, and it focuses on people who have incontinence, prolapse, really the urinary tract of women, just because they are so closely associated with the reproductive tract. And then you have advanced family planning, which focuses on contraception, terminations, abortion care, providing people with choice. You have MIGS or MIS, which is minimally invasive surgery. So learning how to use sticks or laparoscopic skills in the OR or robotic surgery in the OR so that you don't have a big incision, but you have 2 small little incisions when they took out your entire uterus. Pediatric adolescent gynecology or PAGS, menopausal geriatric gynecology. I know I mentioned global health. I mean, there are so many subspecialties within specifically OB-GYN, and then you can definitely explore the other subspecialties that are offered by other specialties. So there's breast. Breast is not really part of OB-GYN care, interestingly enough. So breast fellowships are actually offered within the surgical field. And so you can do a fellowship there to be more able to operate on breasts for your patients. I mentioned addiction medicine, which is under the umbrella of family medicine. And so if you're really interested in, understanding how to get buprenorphine, which is a very specific drug for women who were once addicted to really illicit drugs, and it's safe in pregnancy, you can do that type of fellowship. So you have an expertise in that field. There's so many things that you can do as a subspecialty. But I wanted to end my presentation with this video. I actually was at this conference and I was trying to see if I was in the back of video. I don't think I saw myself, but why some other providers really enjoy OB-GYN. Before the video starts, I think for myself, I love women's healthcare because in my mind, I am a very comprehensive health provider. You know, I am actually going to be going back to get some additional training in family medicine so I can get a full scope perspective of how to take care of like my patients' hearts. But the reason why I love OB-GYN and it's my favorite specialty and I love being people's like go-to doctor, my like women's go-to doctor, is because first of all, we all came from a womb. If you think about it, all of us were birthed from a birthing person, whether that person still identifies as a woman or not. We all came from a uterus, right? Everyone was made the same way, and OBs are the ones to deliver that infant and bring them into the world, that your first hands to be touched. It's really amazing. And then oftentimes for me, I feel like reproductive health care is a taboo subject. You know, we don't talk about sex that much. And sometimes when you're in high school, you're like, ooh, sex. You know, you do your reproductive health care stuff separately than the boys. And, you know, the boys are in one room, the girls are in another room. We really don't talk about that. And I think that we need to break that taboo down because there's actually a lot of not only disease and pathology, but a lot of strength and power that can come from understanding our sexual well-being and sexual health. And it really plays a big role, especially as a woman, if that part of your body is not working the way it needs to work. And it can bring a lot of shame because we've talked so little about it. And so being an OB-GYN provides me a space to talk without stigma to my patients. And it's really intimate and really vulnerable, but I think that it gives people the ability to trust me more. And that's something I really honor. So that's why I love OB-GYN. But let's watch this video. And hopefully the volume is on. Can you hear it? Can you put a shout out in the chat if you hear it for me?
I've always been inspired by women's health, women's advocacy, and so I think that's mainly why I decided to go into OB-GYN. It's really a field where you really connect with your patients, and you are their advocates.
I figured out early in med school that I like taking care of being involved in women's health and then also women's cancers.
Having the continuity of care after they deliver throughout, you know, the menopausal period, that opportunity to be a part of a patient's life and have a surgical role was pretty appealing to me.
I realized that it was a practice that I could be, you know, practice medicine and surgery, generally dealing with primarily well patients.
Really, I decided to become an OB-GYN because it provides the opportunity to kind of do a little bit of everything. You get to do office medicine, you get to do surgery, plus you get to deliver babies. And it's one of the few times that people are actually happy to be at the doctor, be at the hospital. So, you know, it feels good.
And that was my summary. But definitely thank you for allowing me to talk to you all. I think this is a great chance for us to get into some questions and thoughts. I know there were quite a few questions in the chat from people beforehand. And I'm going to stop sharing my screen so I can see all your faces. Let's see if I can do this.
Pon tu cámara, papi.
But let's see where we can start. Well, thank you so much for letting me speak with you all, everybody. I hope this was helpful and a good introduction to OB-GYN and just really medicine in general. I know that especially when you're a high school student, you're like, where the heck do I start? But hopefully this kind of gives you the playing field and lays things out. But let's get to some questions. I don't know if someone will be.
Yes, okay. We got so many questions actually. Would they be able to contact you just in case we run out of time?
Please do, please do. So you can contact me on the Instagram page, which is the Black OB-GYN Project. You just send me a DM, or it might be easier to email, and I will put the email in the chat. I am trying to work with the Future OB-GYNs group to see if we can make a mentorship program And the mentorship program might be a little bit more general, might not just be with OB-GYN, but I think a mentorship program where you can like have someone in your area or community, once COVID especially opens up, this would be super awesome. And you could like shadow them on the floor, you can watch a delivery, you can maybe learn how to scrub. You might not be able to go into the OR because of the restrictions, but like just being in clinic, seeing what it takes to do a pap test or, just talk to a patient in general. So that's something I will be trying to work with the group with, but definitely let me put my information in the chat so that you guys can all reach out to me. But why don't we get started with some questions?
Okay. Someone asked, as a first-generation Canadian American, did your cultural background help you to feel grounded when facing adversity in your career?
That's a great question. So I identify more with my Ghanaian background because my parents are immigrants from Ghana. And so like all around me and, everywhere from the food to the clothes I wear, it's very influenced by West Africa. And that I actually wrote about it in my personal statement. It plays a huge role in my identity, in the way I think about medicine, the way I think about myself and my place in society. I think one example that comes to mind as to why is Ghana has a matrilineal society. And so women are oftentimes the head of the house, just culturally, which is very unheard of compared to a lot of other cultures. There's a lot of respect for women and what we can provide to our communities. And so that made me feel more assured as a women's health provider that I was almost like doing something that my ancestors had always wanted me to do. Being a child of an immigrant and coming from a different perspective, obviously there's challenges in that I know what it means when someone says that they have difficulty understanding or accessing care. For those of you that have parents from another country or who speak English as a second, third, or fourth language, as is the case with my parents, sometimes understanding what your doctor is saying just goes woof, right? The doctor might be saying something that seems really easy for us to understand as Americans or English first language English speakers, but for our parents or our loved ones, it might be really challenging for them. So that experience has helped me understand what other patients might go through, and as a physician, as a clinician, how I could be a better advocate for them, right? How I can really make sure I take my time to explain things. I think just generally, there's a lot of things that need work in medicine too. So being like, I call myself a third culture kid. So I was born in a country that neither of my parents are from. I grew up in a country that neither of my parents are from, that I don't live in the country that my parents are from. So if I go to Ghana, people are like, oh, you're American. I'm like, no, I'm not really American. I'm Canadian, but I go to Canada. But I'm like, well, I lived in America all my life. So it's like this, it's called third culture kid. If you search it online, I'm sure many of you are familiar with that. But I'm also Black. And I'm not like the stereotypical Black person. Like for some reason, people have an idea of what I should look like before they meet me. And then they meet me and they're like, oh. And, sometimes it's said in a good way. They're like, oh, I'm so pleasantly surprised. Sometimes it's said in a bad way. So there's a lot of aspects of my identity that also can make learning or being in these spaces challenging, especially knowing that medicine is only 5% Black. Whereas the population of the United States is 15% Black, and it's a similar percentage for those that identify as Latinx. And oftentimes kind of having people be like, come into the room and be like, oh, nurse, you're here. Finally, can you take my food? And I'm like, oh, I'm not the nurse, I'm the physician. I have people not necessarily react towards me right away as a physician. Thankfully, that hasn't happened too much, but it has definitely happened, and it can be shocking, and it does make things challenging. But I think it also makes me more encouraged to be a physician and be in this space, because it helps me remind other people that people like me can be here or belong here. And I think, I'm thinking how a lot of women used to not be in medicine, and now they're slowly getting into medicine, and actually the numbers are becoming more, but even yet there are less women specialists. Women are being paid less than men in medicine. There's a lot of disparities when it comes to gender, and that part of your identity might come out more so than being Canadian American or Ghanaian American. So hopefully that answers the question.
Yes, I think that was really great, because identity does play a big part in what we want to do in the future. Someone asked, what do you wish you knew before going to medicine? Which I think kind of goes off of what you just.
Yeah. Oh gosh, there's probably a lot of things I wish I knew before going into medicine. I think I feel like everything that's happened, hindsight's always 2020. I think everything that's happened to me has really worked out to make me a really strong provider now. But I wished I had probably known a little bit more about public health because I do think medicine has a lot of work to do. We unfortunately in medical school training don't have much exposure to, like, even though we want you to be like super well-rounded, that's why I was like urging you to do what you love in college. When you get to medical school, we don't focus on the humanities. We don't focus on medical history. And I think that's trying and starting to change, especially in light of what's been going on in society and people really understanding that everything is connected. But that being said, I wish I had more exposure to health policy. That was my minor in college, so I did, but I wish I even had even more. I wish I had more exposure to social determinants of health, which are basically the things that your patients see outside of the clinic. So what is going on a social aspect beyond just the medical aspect for my patients? That's for me. I'm sure my other colleagues or my other friends would say something completely different. But I think overall, medicine has allows me to ask a lot of questions. And so whatever question I have now, I'm probably like, man, I wish I knew that before medical school. But the nice thing is this is a forever learning career. If you don't like learning forever, it might not be for you. But if you love learning forever, then definitely stick with it, because even if you didn't learn it before medical school, you will have the opportunity to dive into it. And I also wish I knew that medical school is not competitive. I think that's huge, actually, and not something I could learn later. Because when you're in college, for example, you're like, I want to be the top of my class, and you're like metaphorically elbowing people out of your way. But in medical school, you better be holding the hand of the person next to you and pulling them alongside you. There's no longer this idea of like, I need to be first. There's no more ranking. Some medical schools are entirely pass fail, no more grades. You just got to pass the test. You could get, pass level could be 60. You got a 61. You passed, you're done. You passed, you're a doctor, you passed. I know it sounds crazy, but it's very hard, right? So there's no more competition in-house with each other versus like high school where you want to be ranked in the top 5% of your class to go to the best college. It's not like that in medicine, because you all worked hard to get there. You would not be in medical school if you did not have the grades, did not have the story for it. So we just want to make sure that you have the understanding of the basics, because you're still going to go to more training. You still have to take tests like every 2 to 3 years. So I wish that someone told me from the beginning, because I learned along the way that there's really no competition in medicine whatsoever.
Yeah, we got a few questions about that actually. So thank you for going into that. And then we got one about, are there any good ways or groups or extracurricular activities that you would recommend to those going into a medical career? Also, do you ever face any setbacks due to political regulations on medicine?
Yeah. So, when I was in college, especially, like I mentioned, did a lot of things that were on campus, and I had these incredible opportunities that took me to be on national boards and took me abroad. The March of Dimes was really amazing because they had this group that was 4 youth volunteers and 4 youth representatives, and I applied, I interviewed, and I was able to get that position and was able to be reelected for the full tenure of 4 years. And so when I think about that experience, and as I get older, I realize there's little things like that almost in every organization, where they really want to know how they can bring youth volunteers or youth advocates alongside them, right? So I just on the phone the other day, for example, with the period movement. For anyone that might not know what that is, the period movement, they are looking at menstrual equity and trying to make sure that every woman or a young lady understands like what it means to have a period and whatnot. And they have a youth advisory council. And I was like, of course. She's like, oh, our YAC. I'm like, what's the YAC? She's like, youth advisory council. Of course they have high school students and college students that are leading the way because their focus is on these students. I remember when I was in high school, UNICEF, I don't know if they still do it anymore, but UNICEF used to do like trick-or-treating for trick-or-treating for UNICEF where you take like a cute little box around. I don't know if they do it anymore. Oh my gosh, I'm aging myself. But you used to trick-or-treat with like a little box and you could put coins in it when you go to people's houses instead of like candy. And they had a youth council for UNICEF that would put on different projects and make sure that they were spread nationally. And it doesn't even have to be nationally. You know, even with your like city council, some say you have a position for a youth city council member or on your school board. When I was in high school, I was on my school board like council where they had, I think like 5 of us from our high school that would sit on these meetings with the principal and be like, okay, you know, this is what we're trying to do for this assembly coming up, you know, students, what have people said from the student level? You know, there's so many ways you can get involved in leadership, or not even in leadership, just as a member. But I think the bottom line is making sure you plug yourself into something that you really enjoy. I can't think of things that are like standardized. And I don't think there's anything that's standardized. There really shouldn't be anything that's standardized, because I would rather see, you know, everyone, how many people are here? 26, you know, unique applicants with unique perspectives. I don't want to see every single one of you here having been on the same exact student council. You know what I mean? Because then you won't come into college or medical school or wherever you go next with diverse perspectives of what it means to be well, or what it means to be happy or excited about life, right? And then the second part of that question about like challenges in like political, like with medicine and politics and whatnot, hopefully I'll interpret this question correctly. I think, you know, medicine more and more is, like I said, needing to open up. And COVID has really emphasized that for us. You turn on TV and when they're asking about COVID-19 or like Dr. Fauci or all these people, like, or like, you know, who else is on TV? All these TV people who are in medicine, they are physicians. Many of them are physicians. And so there has to be this understanding of the political atmosphere before you can really make comment about what you should require patients to do at a community level, right? I can require you to do something as your doctor, but before I can get on TV and say a whole neighborhood needs to do X, Y, Z, I need to be able to understand the government, I need to understand the politics and whatnot. I think especially in reproductive health care and OB-GYN, we see a lot of politics come in when it comes to abortion care, which can be pretty tenuous because of where people are from and their backgrounds. And there's a lot of debate about, you know, a woman's right to choose, et cetera, et cetera. And then also I know government and politics comes in when it comes to like period products. Again, I think of like New Zealand, which just made all their period products like no taxes on it. They're just like able to give them out. It's like something that I think they're free in all schools now. Like it's such a huge step, but things like that requires your ability to talk about politics. From a maternal health perspective, here in the United States, the maternal health crisis is pretty bad here in the US. We actually have a horrible birth outcome rate. Like women, especially Black and Indigenous women, die 3 to 4 times more than other races. And there's a new bill, which I can put in the chat if you want to look it up, but there's a new bill that is going through Congress called the Momnibus. And the whole premise of it is to really try to figure out how we can reduce the disparities and make a more equitable healthcare system when it comes to maternal and infant health. And so I think that's like, these are just example upon example where politics really intersects and interferes sometimes when it makes your job hard with medicine. It makes your job hard because you have insurance, you have like, you know, Obamacare is awesome, but like you also have to make sure you're billing correctly so your patients cannot have to pay so much. So there's like all these little details that you're trying to make sure work perfect. There's this like single payer versus, you know, all these other things that are probably too much for your level right now. But you have to understand the system, because being a doctor, and this is why I said I wish I had more experience or more exposure to this before medical school, being a doctor is not just like listen to your heart. It's so much more than that.
I got a question about doing a fellowship. Is it possible to do a fellowship later on in your practice? Like if I had already been a physician for a few years, would I be able to go back and do a fellowship?
Absolutely. So I think it's easier in some specialties than others. So for OB-GYN, and also depends on the subspecialty, right? So for OB-GYN, it is best if you are, if you want to do family planning doctor, usually that means like, you want to do this from day one of residency and you just jump right into it right after. Because listen, you're not making money when you're in training, okay? Until you're attending, everyone's like, oh, doctors make so much money. No, you're not making money when you are quote unquote a trainee. So you are still making, believe it or not, $60,000 to $70,000 as a fellow. So a lot of people are like, let me get this out of the way. I don't want to be in school. Like, it's not really school, but I don't want to be in this learning type of space a lot of the times where I still might, like I still have autonomy. I can still do things by myself, but I still have a little bit of oversight. So I want to get through this right away. But let's say you've been out in the field of practice and you've realized like you need more experience as an MFM, right? Like you might need a little bit more exposure to these really high risk surgeries or doing, there's like fetal surgery, kind of like Arizona on Grey's Anatomy, that actually can be within pediatrics or OB-GYN, where you're doing surgery on a pregnant woman of the fetus and it's super cool. And you're like, okay, I need to do this. Like I've done this in the field, but I feel like I need to do more. So you can go back. Of course, you have to reapply just like any other application process because everything requires that. And you obviously would have such a unique and beautiful story because you have experiences that can lead you on a different path. Like I said, it is much easier to do that in certain specialties compared to others. I know like a lot of physicians that want to do subspecialties in like addiction medicine or health policy as a fellowship, they can get it paid for instead of like having to be paid so little, and they still work there because they're in attending. So they're making attending money while like doing these extra, it's almost like taking night classes essentially when they do it later on in their career, which is actually really cool. And because it's more, those specific subspecialties are a little bit more broad, it gives you, you can do it anytime. And usually they're only 1 year versus like gyn-onc or something that's 3 years long, or any other subspecialty that can take multiple years.
Also, someone asked about mental health. So what do you think about the physician's mental health epidemic?
Yeah, this is a great question. And I appreciate this question because do definitely know that medicine is not perfect. And I think this is a question, if you could figure it out, if you could solve it, you probably would win a lot of awards, because unfortunately, to the downside, I think the people that are number one in medicine happen to be very type A, very perfectionist. We all work hard. We all love getting good grades. We all really want to help people. We don't want to see anything short of perfect. But I think that can also bite us in the bum, because what happens is that oftentimes we incorporate really unhealthy behaviors while we're learning, whether that's in school or whether we're in practice, and we forget to take care of ourselves. And then in addition, unfortunately, medicine, especially residency sucks. You're working, and I know people don't believe this, but you work 80 hours a week. You work 6 days a week. Like weekends, I don't know what those are really. Like I'm working tomorrow. It's like you work a lot. And I think that a lot of people wish that the residency structure as we have it now could be improved. I know there is a doctor on Instagram. She's a really great page. I actually love her page. It's Shirley Whirl MD. It's Shirley's. I'll figure it out and I'll put it in the chat before this closes out. But she writes all the time about like what we need better wellness infrastructure for our physicians, because if we are not healthy and well, there's no way we can take care of a patient who is sick. Imagine you are sniffling, you're sick, you're just dying, and you're trying to take care of someone who's also ill. You can't think 100%, you can't operate 100%, your hands are going to be shaking, you can't really be at your best behavior for that individual who you say needs to practice healthy behavior. But unfortunately, we find that doctors tend to almost sacrifice themselves. I'm not saying it in a good way at all, like sacrifice themselves in that, which is more detrimental. So the mental health epidemic, and of course that kind of relates to the suicide rates, which are higher in medicine, compared to other fields, the divorce rates, which are higher in medicine than other fields. I'm not saying this to scare you. I'm saying this as these are problems in the field that need addressing. And I feel like if you go into medicine realizing that your wellness is number one and your health and maintenance for yourself needs to come first, you'll become a better doctor, because when you talk to your patients, you'll be able to give them the right advice. And then also you'll be in a program, or you'll find yourself in spaces that respect your health. And maybe you can be a leader in changing the entire dynamic of the field altogether, if that makes sense. But I think for me, I'm really passionate about it. I mean, obviously I've been part of like wellness things forever. But I also recognize it's like it's harder to fix just because of the way our training is set up. But that doesn't mean that there isn't support being made. If you type like physician wellness on the internet, there's like a million little results of articles and tips, and like everyone gets a therapist. Everyone gets a therapist. Like, go to your therapist. And right now you guys are like, oh, therapy, but like, trust me, you ask a doctor, they probably have a therapist. Like there's support systems for them to kind of make sure that they are taking care of themselves so they can be the best for their patients.
Okay, I think this will be the last question because we're close to our time. But what are some ways you feel the U.S. healthcare system, especially maternal health, can be more comprehensive? And also, are you in any way related to Dr. Joel Bervell, the person? Recognized him?
Oh gosh, I'll answer the second one first. Yeah, Joel's my brother. He's my little brother. I am his inspiration. So anytime he talks about medicine, he better bring up my name. But yes. And then the first question is there anything that, well, can you repeat it actually, just so I don't miss all the points to it?
Not sure if I'll be able to find it, but I think it was about how the healthcare system could be more comprehensive, especially with maternal health.
Yeah, I think that's one reason why there's so much attention on maternal health right now, and why there's a focus on that team aspect and care. A lot of the solutions for these disparities in healthcare happen to come from looking and providing your patient with a doula, looking for and providing your patient with a midwife, making sure your patient has good health literacy so they get plugged in with a social worker if necessary and if need be. And I think that plays a hand into like really hand in hand with comprehensive healthcare and medicine. I also think that, you have to realize that OB-GYN, even though we are seen as a primary care field alongside pediatrics, family medicine, we also kind of straddle the line of surgical care and specialty care. And so it's really important for you, once you become doctors, I can't wait to see like all of you become physicians, that you work really closely with the other specialists that are around you, because you're not going to know all the answers. Trust me. You will know everything there has to be about the reproductive health system, and people will come running to you when they need help, when they have questions about that. But when it comes to trying to understand, for example, someone's mental health disorder, you might know only this much of what you need to know about depression and anxiety, but the psychiatrist, they went to residency for this. So you have to go to them to really understand how to provide your patient with comprehensive care. So part of maternal health is knowing when you as a provider need help and need to consult, is what we call it, or you need to ask a friend or refer your patient out to higher level of care. But also recognizing that we're all working for a patient's good and benefit. But I think that if we keep that in mind, of course, that will improve maternal health care and maternal outcomes. But I also think that there's a lot of, it's very multidimensional, why there's problems in the field right now, from the politics of it to the way care and access is, because not everyone can get a specialist. Not everyone can easily find a doula or a midwife, to, the types of problems that we're seeing, whether it's because of racism or classism and things like that. So, but this is one piece of the puzzle, definitely working together with everybody.
Thank you so much for answering our questions. I hope everyone enjoyed our session. And that is it for today. So if you want to sign off real quick.